For our interprofessional collaboration project, we looked into the life of a pharmacist. I'm Morgan Verse and I'm an OT student.
I'm Joe and I'm a radiological technician.
I'm Laura Topp and I'm an exercise science student.
I'm Emma Dyer and I'm a nursing student.
Okay, so in order for one to become a pharmacist, you have to go through a 4-year bachelor program, preferably in the sciences. After that, when you want to move on to graduate school, you have to pass your PCAT, which is the Pharmacy College Admissions Test. After that, you'd get into your admitted college and you'd have to go through a 4-year graduate program. On your first 2 years, you'll be studying biopharmaceuticals, biostatistics, pharmaceutical calculations, physical chemistry, and immunopharmacology. Years 3 and 4, you're going to be studying general pathology, chemotherapy, and you'll take introductory pharmacy experiences. Once you're finished with your graduate program, then you have to get your certification, which is called the North American Pharmacist Licensure Examination. Once you pass that, then you are licensed to practice in all 50 states. Regarding roles and responsibilities of pharmacists, pharmacists fill prescriptions, inspect orders, and make sure that they're accurate, tell patients how and when to take medicine, as well as the side effects of their particular medicine. Pharmacists work in pharmacies, drugstores, hospitals, nursing homes, department stores such as Walgreens or your local Aldi's where you could find them.
So pharmacists provide medications to all types of populations. They provide to patients on Medicare and Medicaid, or they also provide to patients who have their own insurance. It just depends on who needs the medication. Also, pharmacists consult other patients over-the-counter medications and provide information on home healthcare supplies and other products. It just depends on each population as to who needs the medication or other services.
In the interview with Mindy Littmer, who is a pharmacist at a local pharmacy in northern Kentucky, stated her views of interprofessional collaboration. She stated that it is an essential part of the healthcare system. She explained by saying that each individual professional brings their own expertise, which allows the overall care to be lower in cost, and it also improves patient outcomes. Next, Mindy touched on what her most important contribution to the healthcare team. She stated that as a pharmacist, she is able to develop a relationship with the patients since they will make regular trips to the pharmacy to fulfill their prescriptions. She says that pharmacists are readily available to answer any questions that the patients might have, which will then lead to more favorable outcomes with medical adherence, which will then lead to better management of chronic diseases.
Pharmacists work with nurses and physicians directly by talking to the nurse and doctors in order to provide the patient with all the information needed for them to meet their goals. The nurse will give verbal orders to the pharmacist about certain prescriptions. The nurses will also take messages from the physicians about clarifying dosage or questions regarding prescription. Before admitting a patient, a nurse will call from the hospital about the patient's updated medication profiles at their local pharmacy. Occupational therapists and exercise science majors. I couldn't find that much information on these two professions coming in contact with a pharmacist. However, Mindy stated that she rarely works with occupational therapists and exercise science majors. One specific time she came in contact with one was over the phone about sending a walker or shower chair home to a patient. Radiological technicians. After research, I could not find any information about pharmacists working with a radiological technician. Mindy even said she had no contact with them. However, down the line of professions, it would start with the radiological technician and then go to the physician and then last to the pharmacist. All professions would be involved in the patient's plans and goals.
Some of the insights we gained was that all of our professions will interact with a pharmacist at some point in our professional career. However, nurses will be more likely to interact with a pharmacist on a regular basis because they are more hands-on with patients. Overall, we learned that interprofessional collaboration is a big part of the professional world, therefore we should all be aware of how other professionals impact our own.
Thank you for listening to our presentation.